right, we're going to go ahead and get started. I want to welcome everyone to our Trans Health webinar. We have 3 participants in our panel today who have come from the Transgender Health Group, who have volunteered their time to talk a little bit today about how our transgender, non-binary, gender non-conforming folks can navigate healthcare, specifically Mecklenburg County, but also hopefully some helpful information for beyond that. We're today going to focus on some specific issues, especially telehealth, mental health options, and just support for our transgender community during this time of pandemic. We know that transgender people face great hurdles and challenges, especially trans women of color, in getting access to care, access to housing, access to employment, and that has health consequences as well. Mental health, physical wellness and well-being. And so I'm not the expert, so I'm not going to dive into that today. We're going to talk to experts today. We have some questions that we got in from a survey we sent out, and we also are inviting you to ask your questions in the chat. You may notice that everyone in here is muted. For the first at least 5 or 10 minutes, if you wish to be unmuted, just send me a message in the chat feature, and I will be happy to do so. We are recording as well, so this will be available after this is over, so that we can share this with our community and hopefully share this useful information beyond. So I'm going to turn it over to a couple of our panelists. I'm going to give them a brief introduction and give them a chance to introduce themselves and talk a little bit about why they're here, and maybe also just give an opening statement about transgender healthcare access in Charlotte. And I would like to start with Ms. Chapman. So I'm going to spotlight you and unmute you so that you can tell us a little bit about yourself. She is the decolonized psychotherapist, a professional social worker, activist, facilitator, and keynote speaker. She holds a Bachelor of Science degree in psychology from the University of North Carolina, Charlotte, and a Master of Social Work degree from Savannah State University. And I'm going to let her speak a little bit more about her experience and why she is here today to talk about this important issue for our community. So let me unmute you and you can go on.
There we go. Okay, can everybody hear me okay? Thumbs up. You can hear me okay? Awesome. Thank you so much for that introduction and for the opportunity to share space with this distinguished panel and also with the community. Certainly, I'm learning so much how to appreciate the opportunities that I have to interact with people, and this is such an important time for us to come together. It's always an important time for us to come together and talk about the importance of transgender health. As mentioned, I am a member of the Charlotte Transgender Health Group and the founder of the Center for Family and Maternal Wellness. We're an outpatient psychotherapy practice serving the greater Charlotte area, and our primary focus are queer trans people of color, as well as maternal mental health. So we, certainly pride ourselves on performing or providing LGBT affirmative psychotherapy to the greater Charlotte area, particularly youth. Right now with COVID happening, we've just seen overwhelming numbers of people seeking financial and housing resources. Some of you may be aware of sort of in the time of national crisis, folks who are already struggling or existing at the margins of society, like they are the least likely to be able to gain access to certain supports, particularly due to discrimination being written into the legislation and the policies of how to obtain that support. So we're going to be spending some time today talking about services and supports that are available to the trans community. And again, I really appreciate the opportunity to be here. Thank you.
Thank you. Up next, we are going to have Dr. Thomas Marlowe speak. So I'm just going to pass it over to him.
Hello, my name is Dr. Marlowe, Thomas Marlowe, MD, and I want to just reiterate what we've already heard. And I think the good news is that medically speaking, the COVID-19 or the SARS-CoV-2 is not so much going to be a medical issue, but the issues that are going to arise are the ones that are sociological and ones that are driven by other determinants. So the good news is, medically speaking, this shouldn't change your ability to access hormones. But I think that I'm primarily going to be here to be supportive to the rest of the people here who are going to present ideas that are non-medical. But if you have a medical question, I'll be happy to answer them during this meeting.
Awesome. Thank you, Dr. Marlowe. We appreciate your time being here. And last but not least, we have Shital Patel. She is a licensed clinical social worker and former attorney who specializes in working with adults and older adolescents experiencing eating disorders, trauma, anxiety, and working with LGBTQ identities. And I'm going to let her speak more about her experience and why she's here today.
Thanks, Cameron. I wanted to thank the LGBTQ Mecklenburg County Dems and the Charlotte Transgender Health Group for inviting me to speak with all of you today. I think, you know, having community kind of around talking and having these kinds of conversations really around mental health and health for, you know, all of you attending and for us to be able to kind of attend to these needs in the community of the transgender, you know, population, and all of us as a community kind of having these conversations that are open, being willing to just talk about things that I think is a little bit more difficult when we just see these kinds of pieces in writing, and because we can't come together in person, being able to get together virtually I think is a special experience. So I'm really appreciative to be able to have the chance to talk with all of you. I am a therapist and former attorney. I work at Perry Counseling, Healing, and Recovery here in Charlotte. We're located in Plaza Midwood and Uptown. We're doing all teletherapy. We can also work with folks all over the state of North Carolina virtually, which is really nice in terms of access for care as well. And I'm really excited to be here and have this conversation with all of you.
Thank you so much. Like I said at the start of this, the LGBTQ Democrats in Mecklenburg County sent out a survey to our members, and we asked, what questions do you want answered during this time of pandemic and crisis? And so a lot of those questions centered around transgender health access, transgender allyship, and sort of the evolving nature of healthcare, especially under stay-at-home orders that we're still under. So the first question I'll ask, and I'll let Ms. Chapman answer this first, and then probably Ms. Patel will want to jump in as well, and maybe Dr. Marlowe, is about telehealth solutions. So one of the repeated questions we got is, several people mentioned that their current provider doesn't offer telehealth solutions. So what solutions might be available for them, and what would be a good place to turn to? So I'm gonna unmute Ms. Chapman and let her go first.
Thanks so much for that question. So as a mental health provider, that has really been at the forefront of lots of discussions. All of us trying to figure out what are the best ways to create access for clients, what are the ethical ways that we can create access for clients. And I'm really happy to say that one of the biggest barriers, one of the things that we thought was going to be a big barrier is insurance companies and the ability to be reimbursed for providing telehealth services. A lot of people don't realize that it's not typically paid at parity or even allowable in most insurance plans, to be quite honest. But so happy to report that insurance companies have worked right alongside with professional counselors and social workers to make it so that we're able to pretty seamlessly offer mental health services without worrying about, you know, an additional fee to clients or folks who are insured or incurring additional costs as providers. Along those
I believe that we may have lost Ms. Chapman for just a moment, so we will wait for her to join back. Shital, did you want to jump in the meantime?
Sure, I can jump in. I think as Reia was saying, you know, I think teletherapy is a great option if that's possible, being able to help clients through video or phone. But I think we're also trying to be a little bit more creative in terms of creating access as well. We at Charlotte Transgender Health Group created kind of a resource list of some additional options for clients to be able to have some access to mental health support and resources, including some crisis lines, as well as there's like a crisis text line, I think, through Mental Health Americas through Central Carolinas has like a crisis text line number that's available as well, the Trans Lifeline phone number. in terms of creating some different spaces so that if clients are also in crisis, that there are several different mechanisms that we can use to be able to access resources. So those are a few things that hopefully sharing that resource list will give clients some options. And I see that Reia's back on, so I'll let her finish.
I don't know what happened. Okay, but thank you so much, Shital. I was also saying that while the preference, of course, for the safety of clinicians and our clients and community, like obviously, if telehealth options can be performed, like that's the preferred method, but there are some folks for various reasons that still ask to be seen in the office. I mean, obviously we do have an ethical responsibility to make sure that we are providing the services and doing that safely. And so I will say that sometimes just the piece around video conferencing software, like if your current provider doesn't offer that, a lot of some of the boards, our ethical boards, or the social work board or licensed professional counselor boards, they've relaxed their standards a bit so that even telephone conversations are allowable. If folks aren't able to use like a secure HIPAA compliant web portal, I would explore any option that's available. So even if you're checking in via telephone, if video conferencing is available, there are lots of free platforms that are available for therapists to use for sure. So at the Center for Family and Maternal Wellness, we use a video conferencing platform that is HIPAA compliant. It's embedded in your client records. So we don't pass any costs, so there shouldn't be any additional fees or anything like that associated with being able to connect virtually. And then like I said, if absolutely necessary, some people have pretty significant anxiety concerns and they just don't want to conduct sessions virtually. I think it would be really important just to express what your deeper concerns are to your therapist and to ask if it's possible to be seen, you know, in the office, if there's protective, like a mask or, proper protection equipment or something like that, especially if you're displaying, if you're sick or if your therapist is sick. But I mean, we can accommodate that as well.
Thank you. And I believe Dr. Marlowe wanted to speak to this a little bit as well. One of the things I think connected to this too that you might be able to answer too is obviously HIPAA has been one of the biggest reasons that telehealth has been slower to get off the ground. Do you want to talk a little bit about possibly any of the possible HIPAA concerns you've seen or how we're protecting people's privacy with telehealth as well?
Well, actually, things are much simpler. So we've been doing telephone appointments for quite some time, and access to medical care has not been a problem, not just for us, but I know that, so I'm one of the founding members of the Charlotte Transgender Health Group, and we sent an email to all of the members and asked the physicians who prescribe HRT how they're handling it. And it seems like, I think every provider said that they're continuing to do it. And so, for example, at our office, we've had every day, we've had 2 or 3 appointments for trans patients providing HRT. And I know that we're not alone. The rest of the providers in the Charlotte Transgender Healthcare Group who prescribe hormones are still prescribing. And we just have the appointment over the telephone. And so at our office, we make it a little bit simpler. A lot of people of various ages may or may not have used Zoom. We just use the telephone and ask the same questions we would normally ask. And then we use postal mail to mail people the prescription. It arrives in about 24 hours. So my concern is not the barriers that exist right now, because there really aren't any barriers for the hormones, but my concerns are in the future. And so this is something that the rest of the panel are going to be talking about a lot more in depth. But my concern is that the effects of poverty on our ability to get medical care. So most of my patients who are trans are not CEOs. They're not. I've only had one patient. I've been doing this 20 years. I've had thousands of patients that I've helped transition, and I've had only one who is a CEO of a company and only one who is a banker. Most of my patients are mechanics, or they work at Target, or they've been in the military, or they work at Michael's, or they're a police officer. So when this strain happens financially and they're being furloughed or being laid off, what's going to happen then? How are they going to be able to get their medical care then? And that's my concerns for all of us. But as far as getting employment, getting hormones, people have not had any problems. The only one I would speak to is surgery. And there was a question that I would say was maybe not properly worded. It said that physicians are not doing non-essential procedures, but we don't use the word non-essential. Non-essential is more of a pejorative term that I think that legal government has come up with to say these people are essential, these people are not essential. In the medical community, we think of surgeries as either emergency or urgent or anything else. And so the only surgeries that are being done right now are the emergency surgeries. And so you don't want to have one of those anyway. But my patients are all in the same boat. I have patients who are right now hobbling on walkers because they can't get their knee replacement. Other patients who are in severe pain because they can't get their back surgery. Other patients who are having heavy bleeding because of menstrual cycles and they can't get a hysterectomy yet. So for once, you can feel like you're not alone. It's not that transition surgeries and gender-affirming surgeries have been postponed because of some special category, but because, thank God, yours is not an emergency surgery that you're going to die in the next week or two if you don't get it. So I would say overall, medically, I'm pretty pleased with how we've been responding to COVID-19. And I think that the biggest concerns will be in the future, down the road, the financial impacts for patients.
Absolutely, and I think that ties into one of the questions too we had was about people who might need access to telehealth and mental health services who lack insurance. Does anyone wanna...
we don't, I think a lot of the physicians don't take insurance anyway, so it's the same price. It's a fairly inexpensive.
Okay, absolutely. Shital or Reia, do you want to speak to that?
Yeah, so if folks are uninsured, there are those of us who offer like sliding scale services, and so you should inquire directly if there's a particular therapist that you're interested in. Check and see if they have sliding scale. We use the federal guidelines to determine a sliding scale. So usually it's a short application of providing any source of income that you have and providing a little bit of information about yourself to help qualify you for the program. But that would definitely be an option. And there are also some funds that are available through, for example, like Medicaid. Like if a person is uninsured, they may be eligible to receive state funding. And you could go to places like Amara Wellness or Monarch that they have tons of locations, or any other mental health agency in the area that is able to accept state Medicaid funds. And that way you don't have to pay out of pocket as well.
Awesome. And we will post at the end of this, we will post today the Charlotte Transgender Health Group, along with a lot of those resources that are being mentioned during this call, so that you can access them afterwards to help you navigate. One of the questions we had, and I think Dr. Marlowe was really kind of hitting this on the head, are what, from your perspectives, are some of the ways that we can help the transgender non-binary community? We talked at the start about how transgender people already face housing and employment discrimination. Dr. Marlowe mentioned that the employment options for transgender people are different than cisgender folks, and not to mention trans women of color facing higher rates of those levels of discrimination. So what are some ways that we as allies can help support the transgender community during this time of pandemic and beyond?
Is that for me?
Amy, for whoever wants to jump in first. Probably for all of you, but yes, go ahead.
Sure. I'd like to hear from Shital.
Are you talking about employment specifically, Cameron?
In general, right? Not just employment, but employment, housing, mental health. What are the best ways that we can support the transgender community? Obviously, your perspective comes from healthcare as a mental health professional, but if you can connect that to beyond, that's great. If you want to focus just on health, because that's your specialty, then please, yeah.
Yeah, I think I'll talk about it from a mental health perspective. Certainly understanding one of the things that we're definitely seeing across the board is, that loss of employment, whether folks are underemployed or loss of employment, altogether. And I think part of some of the risk that we're looking at as well, particularly in times of crisis when people are kind of resorting to some survival strategies, and that may include some at-risk behaviors, to make money and to get by. And that's definitely something I think as a community that we have a concern around, because there's obviously safety issues that are going on for the trans population that we're aware of. And because of that, that scarcity and the loss, one of the things that we're seeing is that a lot of people are responding in a way that is appropriately, that feels a lot like grief and loss, right? So kind of the roller coaster of emotions, emotions that very much look like folks are kind of going through those stages of grief, because loss of employment, loss of safety, for some folks, loss of housing, that's kind of when we see, things like trauma symptoms really increase, survival strategies. What in the past we might have been working on in therapy might be kind of reducing risk, unhelpful behaviors, managing crisis. And so seeing some of those spike, and then going through some of that, the grief and loss, I think, pieces as well. So part of what, I really advocate as well is connection. And so sometimes what we need to be a little bit more creative about these days is how we're engaging in connection. So if there is some kind of access to virtual or online, so one of the things that I've been working on with some folks is like, how do we kind of transition to coming up with some online support groups as well? So that might be, 12-step programs, or kind of shifting and having both phone meetings as well as virtual and electronic meetings as well. I actually just looked up some appointments for someone today. So looking for some different ways to be able to form those kinds of supports as well, because one of the things that, I feel really passionate about in terms of, being aware of is the risk of psychological isolation, right? Is that even if we're in close quarters with others that we're in relationship with, that those relationships can sometimes not only perhaps be interfering, potentially dangerous, potentially destructive or abusive relationships, is that those can be triggers, right? Whether they're kind of trauma-related triggers or not. And so, being able to be creative about finding some other safe spaces. I'm really glad that you're sharing some of like the lifeline information, the crisis, the text line, so that folks can get some kind of access right now. And it may not be the most optimal thing right now, even teletherapy may not be the most optimal to be able to do a phone appointment or a video appointment. But what I've been talking with some folks about is that part of what we're doing is trying to reduce the P in PTSD, right? Especially if you have PTSD or not, that some of these survival strategies that we've engaged in before that kind of feel like these are my go-tos, right? Like when I'm feeling really, uncertain, I'm not sure what things are looking like, some of my go-tos have not been potentially very healthy or helpful in the past. And so, whether that's finding a friend, whether it's making an extra appointment with your therapist or your counselor, or it's starting therapy. I know that Open Path is one of the other ones. I don't know if we've mentioned that one, but that's another one that you can find some low cost or low fee therapy options as well. If you are part of a spiritual or religious community, that might be reaching out and potentially looking for new options that might be available online, the hotlines or the helplines, but really staying in connection is one of the most important pieces, I think, to mental health that we're looking at with our trans population as well.
Okay, Dr. Marlowe, Ms. Chapman, either you want to add anything to that?
Yeah. Thank you so much. I was also going to offer that there are a lot of mutual aid programs that have been circulating in a lot of listservs. And so one of the ways that I've seen the trans community be able to access support is to ask for it. I think that, of course, sometimes people really struggle around being vulnerable and asking for help. But I know that oftentimes as a person who might be able to facilitate some form of help, I may not assume or know that you need support unless you tell me. And I've just been really inspired by the amount of people organizing to ensure that trans and queer people, particularly trans and queer people of color, have access to housing support, have access to food support, finding ways to, as Shital was talking about, finding ways to foster connection. I know that in my practice as a mental health provider, one of the things that I've been working on with some of my trans clients is really normalizing, and it kind of stinks to say that, like normalizing the collective experience of everyone. But, you know, these are folks who typically experience some form of social isolation on a daily basis. And I think that because so many other people are experiencing that who may not otherwise, I think it's helping to really humanize the transgender experience and for people to draw some parallels that they previously had not drawn. So I would really say that asking for help is a great way to figure out who the sources of support are in the community. And like I said, I've just been incredibly inspired and encouraged by, you know, when someone asks for something, like the community being able to mobilize and make sure that it gets done. So definitely don't discount letting somebody know what you need, because I think that as a community, one thing that we do well is we keep each other safe and we support each other. And so I think in times like this, some people, you know, ask me, like, what does decolonized therapy mean? It means that we practice from a place, like, we care different. We practice from a place of meeting people where they're at. We don't, we're non-traditional or untraditional in a lot of ways. We really get to the culture of healing and caring for people and what does one need. I mean, just the other day, I was talking to a client, and just in conversation, she was mentioning how difficult, like, she was waiting for some money to get loaded to her card. And she was like, I don't know what I'm gonna do. My baby doesn't have any Pampers. And I went right on Facebook and I was like, hey, I got somebody that needs some Pampers. And like, people cashed at me over $150, like, just like that. And we went right to Walmart, got that baby some Pampers, and drove it right over there to her house. Like, some other, like, providers might be like, that's inappropriate boundaries, but I feel like I can't talk to this lady about her depression and anxiety when the only thing that she can think about is the fact that her baby doesn't have any Pampers. It's like, get this baby some Pampers and then we can resume treatment like as per usual. And I just think that's going to be so important. Like, this is, people keep saying, like, this is an unprecedented time, like nobody knows what to do, but I push back on that. Like, of course we know what to do. We know how to take care of each other, and like, you know what the difference between being ethical and unethical is. It's productive to try to focus on somebody's treatment plan or focus on somebody's, like, whatever problematic behaviors when their basic needs are not being met. And I just think that it's important to stay human with each other. Like, I mean, if you think about it, like, I a different level of vulnerability, I really honor that and for what it is.
Thank you. Thank you as well for talking about the human element and how we are building structures and communities to help each other. Dr. Marlowe, I think you posted something actually specifically in response to pregnancy and postpartum support. Did you want to speak to that and also maybe just kind of tag on to what we've been talking about so far?
Sure. Well, first I wanted to say, look, Reia pampers you if you need it. Yeah, so the biggest problem that we're seeing with COVID, I would clarify. So you got the SARS-CoV-2 virus, which causes the coronary coronavirus disease, or COVID-19 for 2019. That's where these names came from. And the things that we're seeing is, even though it's named SARS, which stands for sudden or severe acute respiratory syndrome, we realize that the virus is a whole lot more than just respiratory. And so the people who are dying from it are the people who have, generally speaking, another risk factor. So, and they tend to be cardiovascular. So we're seeing the people who are dying are the ones who have the hypertension, the ones who have diabetes, the ones who have abnormalities of their bloodstream already. So we realize that the SARS-CoV-2 virus is causing things like coagulopathies, which are a thickening of the blood or blood clots. It's causing neurological symptoms. People are having strokes or stroke-like symptoms. 30 to 40% of patients who get the COVID-19 have heart involvement. And so it's not just a lung disease. So as a result, one of the concerns we're seeing is that there's markedly higher rates in the African American community of worse outcomes. And so that's not just due to health disparities, but also due to a difference in the angiotensin converting enzyme 2, or ACE2, which are the receptors where the virus binds. So knowing then that that's the science behind it, the response then needs to be for us to be very proactive in looking out for our trans women of color and our trans men of color, because they're going to be hit a lot harder. And it's not just a matter of the financial things that I mentioned earlier. There's also something physiologically going on. So we need to be very aggressive with helping out. And so the thing that I posted was from one of the specialists. She's a obstetrician gynecologist specialist, and she gives a good 49 episode about Black maternal health, and highly recommend it. In the video that you, or actually audio that you can listen to, it's a Charlotte Talks episode, and they have U.S. Representative Alma Adams, and then also why am I blanking on the physician's name? I am blanking. Oh, Dr. Pam Oliver. So Dr. Pam Oliver is the executive vice president of Novant, and she really gives an excellent, excellent audio. Charlotte Talks.
Awesome. Thank you for that. One of the questions we had pop up, I think we'll start with Shital, is have you experienced any challenges related to clients beginning therapy for the first time using teletherapy?
That's a good question. Let's see. In terms of beginning therapy, I think that piece of building safety and, you know, kind of that therapeutic connection is one of the challenges. I think if it's possible to do video, I usually am trying to do that with newer clients. That is not always possible. So you know, kind of going old school with the phone is something that we need to do. When it is video, I think one of the, you know, the neat parts about kind of doing that teletherapy piece is that we're actually able to see each other's homes, right? So I'm able to see, where's this person living, what is kind of the environmental challenges that may be part of that person's experience. And then we can also do some problem solving around like what's going to help in terms of confidentiality and privacy in that space, so that person can be able to talk about what they need to. And so maybe that is, you know, going to an outdoor space, which may be a little bit non-traditional for, you know, someone where there's an area that they can actually walk. Obviously, with social distancing measures being taken, then we might actually have to change to a walking appointment. And so finding different ways, I think, to get to know each other, but also to problem solve some of those pieces is going to be, you know, I think some of the important challenges that we may not traditionally do in the beginning of therapy. And I think there are ways to work with that. You know, being able to see somebody's space, for example, actually helps to get to know each other better. And they're seeing my space as well. You know, they're seeing like I'm in my home. You know, I'm juggling other things as well. So I think as someone who is also kind of in this same kind of transition, it's very much, there's not a lot of kind of like space between us in that way. It is very much personal. You know, we're kind of being creative together. We're being a little bit flexible together. We're getting to know each other in ways that being in an office, you know, just doesn't lend for this time. So I found that there's definitely been some flexibility in getting to know each other. And for me, I really like incorporating kind of, you know, humor and being real with one another in therapy. And so I think that's kind of lent itself in some ways to, you know, being connected pretty quickly in starting therapy.
Yeah, definitely. I think setting expectations up front is like really important. Like for some people, if this is absolutely their very first time attempting therapy, like that conversation looks a lot different in terms of what can you expect. For someone who maybe hasn't experienced teletherapy before, just letting them know like how it goes and what the, you know, sometimes I found myself having conversations around what does HIPAA mean, and you know, can other people hear us, especially if folks are using like Zoom. We don't use that. We use a different platform. But as I mentioned earlier, some boards and insurance companies have or made provisions for therapists to use, Skype and Zoom and, other types of video conferencing platforms, just due to the overwhelming need to provide mental health supports to people. And so it's just my practice that we don't do that. I will pick up the phone and call someone before I just use a unsecure video platform. I just don't want to deal with any issues along those lines. But to Shital's point, like, my personality with my clients is very like down to earth, because if you're at home and somebody else is at home, like, there's a different level, like I mentioned, of vulnerability and of intimacy there. The environment can be unpredictable. This is a different thing when I'm working from home pre-COVID, but if you're working from home and your partner's working from home and you got a dog and you got a baby, like, there's stuff that can be happening in the background and you can't pretend like it's not happening. And so I found that, my training as a clinical social worker absolutely says, what is transference and countertransference look like? What is boundaries? How do you keep yourself here and the client there? And I just find that to be unnatural. Like, I do think there's a difference between telling your client all your business and answering them honestly when they ask you how you're doing, and when my clients ask me how I'm doing, like, that to me is a sign that they trust me and that they care about me, because they know that I care about them. So when they ask me how I'm doing, I might come out and be like, girl, I'm struggling. Like, I don't know. But, I think clients can feel that. They can feel when you're being genuine and authentic with them, and when you're just checking the box off to get through your next session. And I just think this experience in general of, being socially distanced from one another, and everything that comes along with it, like, I can appreciate in this experience just the opportunity for people to feel more comfortable in their vulnerability, just because I find that's the place where we all heal. Like, when we can put down the facade, when we can be real with one another, when we can acknowledge, like, this sucks, and there's nothing that we can do about it, when we can, see each other as human and not as like a cog in the machine to like meet each other's needs. Like, that's where I find my efficacy as a therapist, in the human element.
Awesome. Thank you for talking through again. I know the challenges on your end as well, right? Providing care for people during this extra stressful time. So thank you as well for all the work that y'all are doing to go above and beyond to meet your patients' basic needs and their mental health needs and everything else that's going on. One of the questions we have that is probably right up your alley is, we actually got several people asking about different self-care things they can do while they're isolated at home. We do know that, especially for our transgender community, that a lot of times their initial coming out as trans, they lose a lot of their families and connections at that time. So, for people who've built up a network over time after that initial loss, but also for people who may have just recently started this process of being true to themselves and now being disconnected. So what are some, we've talked about, I know Shital talked about some of our negative coping strategies. What are some positive self-care strategies that you could recommend to people during a stay-at-home time? Anyone want to start that off? Dr. Marlowe, we'll let you go first if you like.
Okay. Well, we actually put together a handout for when patients are, quarantined or isolated, and this is the time to get back to. And this is what I tell patients. I say this is a time to get back to yourself. And so there's so many things that you in your life have put aside and haven't really had a chance to address. So for me, I have stacks of comic books that I haven't sorted in forever. For me, I have a stamp collection from my childhood, and I hadn't sorted it forever. I'm finally having the chance on the weekends to go through and do that. I finally cleaned out the shed. I'm finally spending more time outdoors. I think most of us are spending more time outdoors. And calling people you haven't talked to in a long time and checking in on them. So one of the things that I think is valuable for self-care is actually reaching out and taking care of others too. And so when you reach out and you reach to others that you know, that you love, and ask them how they're doing, that's an important part of self-care. And make those phone calls and reach out to other loved ones, even people you haven't had talked to in a long time, and that itself is therapeutic.
Yeah,
Awesome.
I
Reia, go
think
ahead. Yeah.
one of the things that I've been talking a lot about with clients is the importance of maintaining routines. This is definitely like a different type of working from home. Before COVID, it's like, I'm working in my pajamas, like I got this, it's great. But now, part of, I think, managing your mental health is, girl, if you haven't taken a shower in 3 days and you got the same pajamas on, like, you need to get yourself together. Like, that is not okay. Like, if I've talked a lot about consumption in this time of staying at home, that some of us are overly consuming carbs, some of us are overly consuming like Netflix, some of us are overly consuming Zoom and like WebEx meetings. Like, if you're not like a cocktail sampler person as a professional, you should definitely not be sampling cocktails at 8 o'clock in the morning prior to going to like work from home work, right? Like, I think there's also, sort of these two different ideas of, you need to come out of this quarantine time like completely remade and reimagined and leveled up. And that may be working for some of us. Like, that's my personal goal, to like get my professional stuff all the way together in this time, because as a CEO, it's like super, I spend the majority of my time doing counseling my own clients, supervising my staff, interns, and things like that. And so I've definitely been able to take some time to start writing and to start blogging. These were personal things that I wanted to do, but I also push back on people who demand that of me or demand that of anyone else, because for a lot of people, I think the part that folks have to acknowledge is that we're existing in an unnatural environment. This isn't a natural place for people to be creative. Like, for some people, it's anxiety provoking to go outside and wonder if this person's going to infect you with something. I was talking with a client earlier today about how her anxiety and irritability was increasing. And when we went through the layers, it had a lot to do with, I can't even see people's facial expressions because they're wearing masks. So I don't know if they're like smiling at me, if they're angry at me, like somebody chopped my head off because I picked up the milk and decided I didn't want that milk and I put it back down, and now someone's thinking I contaminated the milk. Like, it's an unnatural environment for us to exist in. So I think really extending grace to ourselves to not be this super productive, super accomplished, like I came out with new web courses and all this kind of crap. Like, if you have the energy to do that, like, do your thing. And also, if you need to not be doing any of that to take care of yourself, then allow yourself that space, because this isn't like, nobody signed up for this. We didn't have a plan for this. Most people had to make a very quick adjustment to this environment. And I don't know about anybody else, but it's like every single day, like you're grasping for straws from our national leadership, from our local leadership. Somebody tell us what to do, what's going on, like, when are we going back, like, how are we staying? Like, there's so many different things that's happening right now. And for some people, if all you can do is make sure that you get up and make your bed and brush your teeth and like drink some water or do what you need to do, like, that's enough. That is totally enough.
I love all those things that you just said, Reia. I think, being real with our clients is so important in this way. And one of the things that, I like to do with my clients is kind of create some coping strategies in terms of like a cope ahead plan or, just a general coping plan. And sometimes it's like a coping plan for every day. It could be a coping plan for every week, to really put some concrete things in place as well for them. Like these are the things that I can do if maybe I'm having urges to do something that's not really helpful or healthy for me. These are things that I can do in terms of self-care. So one of the things I suggest if experiencing high levels of distress is using this temperature change strategy. So that might be, it might be holding some ice. It might be holding, if you are in a place where you have, where you can have access to like, freeze a frozen orange or a frozen lemon. So what's nice about those is they've got some texture, and the temperature change piece is actually going to kind of shock your brain a little bit back online. You can use like a cold washcloth on the top of your forehead. You can run some cold water under your wrists as well. So a way to kind of change our body temperature is kind of what we're looking for in terms of reducing levels of distress. And so getting back into, a place where we're starting to feel a little bit more grounded. And so because we know that anxiety and stress really live in the body, starting to move that around can be really helpful. So I mentioned like walking earlier. So repetitive movement or repetitive activity is something that I've worked with clients around putting in their coping plan. So that might be walking, it might be body weight exercises. It can also be things that you do with your hands. So knitting, crocheting, origami, coloring, things that you can be doing in kind of that repetitive way. Another thing that, I talk to clients about, especially with the uncertainty that we're all facing, is if you've got a specific situation, we're going to make a list. So these are the things that are things that I can control, the things that I can actually do right now about this situation. And then these are a list of the uncontrollable factors. So I think there's a lot of acceptance that goes into that, making it concrete and putting it in your own handwriting, and being able to kind of take that step back gives us a little bit of perspective. So perspective shifting, I think, is the other piece that's so important in this environment. Being able, when we start to feel really reactive, or the uncertainty, the panic, or the fear starts to get us, is to be able to take that step back, realize like, yeah, we're all in this unprecedented time, together. And so what we're kind of shooting for here is progress, not perfection. Right. So even coming up with some affirmation or some coping statements that are going to help you when you start to feel some of that panic. So like progress, not that I talk about with clients, closing situations with like, I'm doing the best that I can right now, and that's enough for today. Kind of creating those coping statements, those affirmations, things that really kind of refocus you around like, how is it that I want to feel about myself in this situation? How do I want to feel about myself today? Because so much of the time it's these really powerful, sometimes painful emotions that really get us, and we're kind of going through the roller coaster of emotions. So also thinking about, how is it that I want to feel today? And what are the things, Reia mentioned, like kind of routine, right? And like consistency. What are the things that I used to do before that were bringing me a sense of joy, a sense of peace, a sense of calm? Like, what are things that I can integrate back into my life that help me feel that way? And maybe that is walking. Maybe that is coloring. Maybe it's trying something new, but I think everybody has some things that they can kind of pull from. And maybe that is creating this kind of coping list, right? So that if I'm not feeling so great, if I'm going through the roller coaster of emotions, the idea behind a coping plan is I don't second guess the plan. I execute the plan. And part of that plan might be social supports. Part of that plan might be the crisis lines. It might be those virtual online groups, that we talked a little bit about. But part of the reason why I love the plan is that when we're feeling, not like our best selves, we're feeling panicky, we're feeling blah, we don't really know what to do. We can kind of just get frozen. And so the idea behind the plan is we execute the plan, and we put enough options in there so that we've kind of got some bumpers around there. And you can include your providers or mental health professionals, friends, like anybody and everybody who are kind of your go-to supports as part of your plan. But the other piece of your plan is like, what can I do to take care of myself in the moment that gives me enough options?
Awesome. Thank you for some of those self-care strategies that we can use, and how you also reach out to your clients. Please continue to ask questions if you have them using the chat feature. A question that was submitted directly to me privately was about sort of COVID-19 hospitalizations, emergency scenarios for potential clients or transgender people. What do you do in that kind of situation? How would you reach out to someone? Like we've all heard about the COVID-19 patients who are alone in their hospital rooms where they can't receive visitors, and how that extra stress too of those social supports. So are you able to do telehealth in those situations? How would you advise someone to reach out to someone in that situation?
Well, this might be more weighted toward Dr. Marlowe in terms of what's happening in the hospitals, but I am also encouraged by the fact that I'm so gracious that there's not anybody that I know that's personally been impacted by COVID-19. I do have a client that is impacted indirectly, but I'm not sure the landscape of what's happening in our hospitals. Like, I know that pretty much each of the hospitals have positive COVID cases. I know that the doctors that I've been in communication with, all of them have mentioned how well they're working together to support the patients. And I think that even outside of a COVID situation, it's really like, as also like a queer woman of color, I've been having conversations with my fiance about, if something happened to one of us, like how would we ensure that the other person can make medical decisions on the other's behalf? Like, these are very real conversations. And so even if and you put something in writing around who you want to be contacted on your behalf, who should, making sure that there's a person like an emergency contact, that any directives or whatever, just generally, not even with being at risk to COVID, but just in general, I think it's good to have for someone to know like what your wishes are, for someone, like in case of an emergency, we have something called like advanced mental health directives, and there's legal documentation and stuff like that that you can actually complete yourself, like complete online, or get the documentation online to make sure that if there's ever a time that you are incapacitated and you can't make a decision about your health care for yourself, that there is a trusted person who's able to do that, or at the very least, you've communicated what you want done in a situation like that.
I have personally not had a situation where a client has contacted me from a hospital situation yet, so I'd probably defer to Dr. Marlowe on kind of what those experiences or what the possibilities might be like. I think personally, as a teletherapist, I would be open to providing any kind of care in whatever the environment that the client feels comfortable with. Obviously, if there's workers kind of going in and out, we talk about that in terms of confidentiality and privacy and what that person really prefers. But I think, again, being creative and flexible to be able to meet the client's needs as much as possible. If it's someone who's supporting someone who is in the hospital, again, trying to find some spaces if we can, is something that I would probably advocate for, and talk to folks in the hospital if that's what was necessary to try to help the client out.
So I have privileges at Novant Hospital System, and also privileges with Atrium. And every day, maybe every 2 days, I receive an email from Novant with the most unbelievably long attachment I think I've ever seen. So every day there's like 34-page update on what they're doing. And I'm just going to read you a few things that they said, because they really do, they're working very hard to address this head on, and I'm really proud of what they've written. So this is from an update from this morning. They had 2 updates today, one this morning, one this afternoon. And this is from Novant. This is the president and CEO, Carl Armato of Novant Health. What he said was, we understand the science of this pandemic, and we know it doesn't discriminate against people and individuals. Now more than ever, we need to focus on diversity and inclusion and make sure we're looking at patients through the equity lens that Novant Health has developed. Want to make sure everyone feels valued across our system. Let's focus on healing. And I just want to say really quickly, I'm not I am a private physician. I have my private practice. I'm not trying to tout Novant. Atrium's doing a fantastic job too. Here is another quote from what they're working at Novant, and I say they because I'm not part of Novant. I just have privileges. And it talks about communicating with empathy during the COVID-19, and it advises their staff. It says patient suffering has increased with the uncertainty of COVID-19, and many of our patients are feeling scared and lonely. It's more important than ever before to acknowledge stress and provide empathetic communication. The acute care patient experience has created tips for communicating clearly and with empathy during this time. A few of the tips include: start out by introducing yourself to the patient and explaining them the purpose of the personal protective equipment. You know, if you're wearing a mask and the person doesn't see the mask, they're, you know, frightened, or they don't see your face, like Reia said. Partner with the patient to establish one friend or family member as a single point of contact to ensure consistent communication with their loved ones during visitor restrictions. And place the name and phone number of the point of contact on the whiteboard for all care team members. And then confirm the patient has the proper communication modes for contacting their loved ones. So I know that Novant is working very hard to really do a good job with that. Again, each day I receive an email with unbelievable number of pages. I can't read from one of them because I would have to sift through and try to find it, but they have multiple examples of how they're using the chaplaincy and doing virtual chaplaincy with the patients. So when patients have spiritual concerns, they call it Code Lavender, I believe, is what I recall from reading one of the emails. So your priest or your pastor will be able to come in and provide you spiritual comfort. So this is not meant, again, as an advertisement for Atrium or an advertisement for Novant, but just to let you know that the hospital systems do care very much about the question you just asked, and they're working very hard to make it as human and helpful as possible. So even though I'm not part of the hospital systems myself, I'm a private practitioner, I'm really admire what they've done.
Awesome. Well, thank you for giving us that insight, because I know that that is a stressor for all of us, right? Thinking about ourselves and our loved ones and what that situation would look like. And so I don't have any other questions that I've seen come in. Please, again, if you have them, ask them. And so I'm just going to give some time to each of you to sort of, I guess, give, for lack of a better word, closing statement, your closing thoughts for our conversation and time together today. Again, we really appreciate your time, all the information you've given us. And so I'm just you're gonna go left or right on my screen. So I've got Shital, then Dr. Marlowe, then Ms. Chapman, all right?
I guess in closing, you know, one of the most powerful pieces I think right now about being in this experience together with our clients is being able to kind of extend that compassion and grace, you know, to one another, just trying to be real, trying to be human, and give ourselves a little bit of room. You know, I think for us, that self-compassion is one of the most important gifts that we can give ourselves, and also that extends out to others, right? I love what you said, Dr. Marlowe, earlier about remembering, like, giving to others. We know that contributing and kind of stepping outside of ourselves and being able to connect with other people is kind of that gift that we give each other. And so I think that self-love, and if we've already been doing kind of work in like the self-improvement process, that like now is a good time to keep doing that good work. I'm not saying you have to knock everything out of the park. Like, we're not going to do everything perfectly right now. But if there's things that you've been working towards already, personal goals, like, you know, reach out to one another to keep going with that. But I think, you know, one of the things I like most about my practice and doing, you know, inclusive and affirmative practices, that we just see each other as people. And so being able to like make that extra effort towards meeting each other's needs. And for a lot of the time, it might be that problem solving piece, right? Like, we're not working, you know, on concrete treatment goals that feel like we need to kind of work through ABC, that we're able to be kind of real about, like, look, today we're just talking about some problem solving strategies. Like, we need to get some basic stuff done. We need to talk about, like, how are we going to come up with a transition plan for this thing that you're up against together. But also being able to do it with, you know, some humor. as well, because lightness and joy, like those need to be a part of our regular lives. And so like maybe we have to like, you know, be a little bit more creative about how we're doing that. Like, am I listening to a funny podcast while I'm doing this one thing? Maybe it is. But I think that's the other part, is that, you know, I'm also really talking about like increasing positive emotions and like increasing positive experiences that we can in whatever creative way to be with one another, you know, because I think maintaining hope and, you know, those principles that, at least for me as a clinician, feel really important around empowerment and choice-oriented work still feel like an important part of the process. And so kind of us just collaborating on this together. I don't really see myself as an expert when I'm with my client. I consider my clients, you know, like, you guys are the best judge of you. So let's work together to figure out what's going to help you most in this moment.
So I would say two things that I want to say in summary. First, going off of what you'd already said, I'm gonna quote Mr. Rogers. So Mr. Rogers said that when his mother advised him that whenever things were tough and when the world looked bleak, to look for the helpers. And that's what I would advise each of us to do. That when you're seeing this rough time, look for the people who are helping out. Don't focus on the negatives. Don't focus on things that make you anxious, that you can't control, but look at the people who are helping out, turn to them if you need it, and if you can help out, then you turn and help out other people too, okay? So that's my first thing. My second thing is turn off the news, turn off Facebook. The information you're getting, a lot of it's false. When we get actual accurate medical information, the news media has taken this opportunity to turn what is a bipartisan, medical, scientific, sociological crisis and turn it into a political tool to try to manipulate people. And so whichever side you're on, they are trying to turn the narrative to say something about how you should be anxious and upset about these people here who are doing this or those people here who are doing that. And they have a secondary gain. They have a reason that they're doing that. They have a reason why they're trying to manipulate you into what you're reading to push your hot buttons. And so turn off the Facebook, turn off the news, look for more reputable sources of information. The Johns Hopkins website is an excellent website for getting information about COVID cases. The CDC is a good information for getting guidelines. But turn off the things that are just seeking to manipulate you. And ask yourself when you read it, like, is this something that they're trying to make me want one political decision or another? And if so, maybe that information is not very valid.
And I would say in closing, two things. Demand the best of your healthcare providers. Like, if you're seeking mental health support, medical care, and you're not being treated with dignity and respect, find somebody else. You can for sure reach out to the Charlotte Transgender Health Group for support, even if any of us don't meet your needs. Like, we're all very well connected and we can get you connected to someone who may meet your needs for you. So, you know, don't ever feel like you have to be stuck with someone and to take whatever you can get. That's absolutely not true. And I will also offer one thing that has grounded me in the most challenging times of my life is to remember my resiliency, that every intersection of my identity has been oppressed at some point, and that I'm still here, you're still here. If you're Black, if you're brown, if you're trans, if you're queer, if you're fat, if you're Southern, like, it doesn't matter. Any of those things that have, you know, been picked apart and split apart by some other group of people. There are so many of us who stand on the shoulders of people who have walked that journey to make sure that you're still here. And so you already know how to survive difficult times. Like, if you're, you know, a queer person of color, you already know what it's like to feel isolated and withdrawn. You already know what it's like, you know, for people to look at you as if you're going to contaminate them with something. And so try to dig deep in the thing that has led your survival, and hold on to that thing, like everything you need to know to make it through this uncertain time, like you already know, it's already born in your experience, because it's 2020 and the world looked a whole lot different 20 years ago and 40 years ago and 60 years ago. And so, you know, if you find yourself disconnected from how to survive, like reach into another person, reach into somebody. Don't sit over there in isolation by yourself and not tell somebody you're struggling, because even if we're struggling together, at least you won't be alone.
Thank you so much to the Charlotte Transgender Health Group and our three panelists today who have provided us a wealth of experience, expertise, and really, I think most importantly, empathy for how we should be reaching out to each other and supporting each other during this time. On behalf of the LGBTQ Democrats in Mecklenburg County, I want to thank everyone for taking the time to educate ourselves and also to re-energize ourselves for how we can support each other, whether that's providing Pampers, whether that's reaching out to give to a food pantry, whether that's being the one call for a person. I think it's important to remind everyone here and across that you are not alone. There are people here who value you, they value your gender identity, they value your race, they value who you are as a human, as in your entirety as a whole. And so I think it's important that we acknowledge the full person, just like Dr. Marlowe was talking about Novant's directives of going the next step to acknowledge a person. There are resources that I provided in the chat box. If you or someone you know is in crisis, please reach out. There is a text line if you don't want to call. I'm a millennial. That's 741-741, 24/7. You can text any word to them and they'll respond back. Again, thank you so much everyone for your time. Be safe, stay well, and have a great evening.